Government policies linked to COVID-19 can save lives. Policies can also save jobs. Is there a clear trade-off? Joe Coletti, Senior Fellow in Fiscal Studies at the John Locke Foundation, has tried to find the answer to that question with a COVID Misery Index. Joe, first of all, tell us, what is this COVID Misery Index?
Right. So if you remember, not sure how many people at this point remember, back in the 1970s, people talked about the Misery Index, which was the combination of high unemployment and high inflation that the country had then. And usually you think of those as trade-offs. And with COVID, it's been kind of the same conversation for the past year, that whenever somebody was opening a state, there would be complaints that they're putting lives at risk. And whenever somebody would close down economic activity to try to save lives, there would be complaints about the trade-off on the other side. So the COVID Misery Index is saying these two things most people think of as trade-offs. There's probably, in some places, if there is a trade-off, you would hope that the index would get better. So you take a look at the number of jobs that are lost per million people and the number of lives that are lost per million people in each state, and that's so that you can take out anything with population, and if I combine the two together into an index based on the worst state in May for jobs, May of 2020, which was New Jersey and on lives, and the worst state for jobs in May of 2020, which was Nevada, set those as at 100 and see how everybody else does against that. And then we can compare over time for each state, and we can compare states against each other and kind of have a good measuring stick for what's going on across the country.
Now, it sounds good. As you have actually looked at the numbers, you found that the pattern is not quite as clear as we might have expected.
Right. The pattern at the start was there was actually a clear pattern at the start, but it was that states that were doing poorly with COVID deaths, like New Jersey, Michigan, New York, were also, because they were closing down much tighter, they were also doing very poorly on jobs. As things have gone on, we've seen that something that that most people would expect is that that there is a trade-off, that more jobs means more risk. Less risk for lives to be lost means that you're closing down the economy more and putting more jobs at risk. But there is a slight trend in that direction, taking a look at the entire past year, but it is very slight. And overall, it looks like there's not really a lot that predicts one way or the other, even on a month-to-month basis at this point, or even over time. And so there's not really anything that policy. There's no real trade-off between, are we saving lives and putting jobs at risk, or are we saving jobs and putting lives at risk? Everybody's kind of in the same position, regardless of what the state has done or regardless of what individual choices people are making. We're all kind of at risk for jobs. We're all kind of at risk for to be hit by the disease, and the jobs are coming back more as more people become comfortable moving about.
How has North Carolina performed on the index?
Right, North Carolina is 13th lowest overall on lives lost, 23rd highest overall on jobs lost. So we do a little bit better on the lives than we do on the jobs, but 13th overall on the total index. And part of that is that the lives lost it has a much wider difference between a low a minimally hit state like Alaska or Vermont or Maine. Washington State has also done well in terms of the impact of COVID itself. New Jersey, Massachusetts, New York, Connecticut, Rhode Island, the New England states, and a couple southern states like Alabama are starting to do poorly on the lives lost, and there's a huge difference between those. The jobs lost, except for Connecticut, everybody's in a relatively small band. That's not where we were at the start, but as more states have opened up and as the restrictions have been more confined to live venues, restaurants, bars, it's affecting a smaller portion of the economy. that is allowing more states to have more employment back and stronger, and that gap is smaller on the job side. So North Carolina, because we do much better than the national average on the lives lost and slightly worse on jobs lost, we end up with a pretty good score overall.
Given what you've seen in the data and the changes over the months that you've been looking at this, are there any implications for public policy and what we should be doing based on what we know has happened in the states?
Yeah, well, taking a look ahead at future pandemics, we should have greater humility about what can be accomplished through public policy, and there's clearly some of these things have been through personal choice and not by what the government has mandated. You can see that traffic is down. Traffic and travel are down as much in open states as they are in closed states overall. And thinking in terms of the other effects. So this looks at jobs and at lives, and it doesn't take a look at the lives lost for other causes, because we know that there was a lot of delayed medical treatment early on. And North Carolina has had high excess deaths over the course of time, unrelated to COVID, and mental health questions that we've seen arise, and suicide increases among younger people, learning losses, all of the other things that go on are not included in this, and those are much more devastating effects than being without than one would otherwise think. And so being able to include those and think about that broad picture it would be something that policymakers especially should be cognizant of, and should fuel their humility on that side.
If you'd like to learn more about this, you can go to the John Locke Foundation's blog, The Locker Room, and look for a post with this title, Policy Differences Across States Have Little Impact on COVID Misery Index. The author of that update and the author of the COVID Misery Index itself is Joe Coletti. He is Senior Fellow at the John Locke Foundation. Thanks, Joe.
Thank you, Mitch.